Hello, I'm Dr. Dennis Spiller. I'm a board-certified cardiologist and board-certified internist, and also now board-certified in anti-aging and functional regenerative medicine, practicing cardiology and internal medicine, and also anti-aging functional regenerative medicine in South Florida. I'm first and foremost a cardiologist and internist, but I found that really something was missing in my practice. I wasn't really seeing patients get better. Of course, we enjoy practicing acute care cardiology. Somebody comes in with a heart attack, we treat them, whether with coronary intervention or with surgery. Of course, we see immediate benefit, but long-term the patients just don't seem to get better. I think what I've learned from the fellowship and been practicing for the past 2 years in anti-aging functional regenerative medicine, I see actual improvement in these patients. Instead of the patients getting worse and continuing to deteriorate, I take them back the other way. I see patients looking better, getting healthier, getting stronger. I see plaque reversal. I see patients having less and fewer cardiac problems. With the addition of full spectrum anti-aging functional regenerative medicine, benefits that I wasn't seeing just practicing traditional cardiology and internal medicine. And I like to do some vascular aging testing, including a carotid intimal medial thickening test, coronary calcium score. And that can give me a pretty good idea about their vascular age. We also do some very sophisticated lab testing, including an advanced lipoprotein particle profiling, micronutrient antioxidant status profiling, telomere length testing. All these are really, once I have this testing and results available, it gives me a good idea where the patient stands as far as vascular and general aging of that particular patient. From there, I develop a protocol where I can slow and in many cases reverse their aging process. In addition to that, hormone testing is also of paramount importance for men and women, including the thyroid, testosterone, growth hormone, estrogen, progesterone, of course, for women. Putting all of it together, the micronutrient analysis, antioxidant status, vascular aging, the hormone profiling, I get a good picture of where the patient stands from an age process. And I can age them from a biochemical, molecular, and on a biological basis. And from there, I can intervene dramatically and effectively to slow and in many cases reverse their aging process, whether they do or do not have diseases at that particular time. So I do focus on the cardiovascular system, but basically I'm certainly looking at the effect of the causes of the aging process and how it affects all parts of the body, not just the cardiovascular system. I address all of it because keeping a patient healthy on a cardiovascular standpoint is only part of the story. It's only part of the equation. You want to prevent neurodegenerative diseases, diabetes, hypertension, infectious diseases. That's the new paradigm today, treating infectious disease. There are very few antibiotics coming out on the market now to treat infections. Very few in the pipeline. I was talking to my infectious disease colleagues. So what's the new paradigm? Enhance your own immunological system. How do you do that? What I've already outlined. Your antioxidant status, your detox status, your micronutrient status, your vitamin D3 levels, your hormone status, both testosterone hormone, thyroid, etc. All important in upregulating your immune system to prevent infectious diseases. That's a new paradigm. That's what's going to keep you healthy and prevent infectious diseases. That's a good example. So if you'd like to know more about how I've added anti-aging functional regenerative medicine to the practice of cardiology, you can email me at dspiller@mitchell.com or contact me at the office at 954-967-6550 or visit our website, which is mitchell.com.